احنا لايف على اليوتيوب، وهعمل ستارت ويبينار 5 minutes وحضرتك تبدا ان شاء الله.
هنبدا كمان 5 دقايق بتقول؟
يكون الناس كلها حضرت على الاتندنس.
وخمسة. طيب انا هعمل فيزيت سريع الحمام ثانيه واحده.
احنا لايف على اليوتيوب وهعمل ستارت.
مظلوم كله تمام كده؟
تمام يا دكتور، يو كان ستارت.
انت بتقول قدامنا ايه، دقيقه؟
اوكي
تمام، كمان دقيقه.
تمام يا دكتور، اوكي من حضرتك.
So are you live now?
Yes, we are live.
السلام عليكم شباب، كيف الحال؟ الحمد لله احنا بدأنا الجيرني بتاعتنا وبنكمل فيها الجيرني بتاعتنا فور الهاكاثون، مش الهاكاثون، الجيرني فور ذا برايز، فور ذا بيج برايز ان شاء الله. زي ما قلنا كل الناس متحمسين، كل الناس عايزه توصل انها تبتدي تاخد تشوف مين هيحصل على البيج برايز ان شاء الله. فاحنا بدأنا الصبح اتكلمنا على التيم بيلدينج، وقلنا التيم بيلدينج قد ايه حاجه مهمه. اتس فيري امبورتنت ان الواحد يقدر يسلكت التيم بتاعه ويعرف مين هيشتغل مع مين. ولازم الواحد يكون دايما صادق مع نفسه، زي ما قلنا ان هو لازم يفهم نفسه كويس قوي، يفهم الناس اللي حواليه علشان يقدر يبني التيم الكويس اللي يقدر يحقق النجاح. مفيش حد هيقدر يحقق نجاح لوحده، لازم يحققه مع بقيه التيم، فايتس فيري امبورتنت. وبالتالي هو لازم يبقى عارف نقاط قوه ضعفه ويبتدي يواجهها كويس جدا عشان يعرف يتعامل معاها ازاي. طيب احنا دلوقتي هننتقل بقى لموضوع تاني، حاجه مهمه جدا. احنا كنا بنتكلم على الفاليو، على موضوع الفاليو كريشن، ازاي اقدر اكريت فاليو. في حد بيسال جود افترنون، في حد بيسال على حاجه يا شباب، مش عارف، جايز عمر يكون عنده تشالنج او حاجه ممكن الشباب يتعاملوا معاه. سو فار هنبتدي بقى نشوف موضوع الفاليو كريشن. وات از فاليو كريشن؟ قبل ما نعمل فاليو كريشن برضه نتكلم، احنا اول يوم في الافتتاح اتكلمنا على موضوع الفاليديشن، واتكلمنا عن موضوع الفاليديشن، وقلنا الفاليديشن على 4 محاور. الفاليديشن له علاقه بالبروبلم، له علاقه بالكاستمر، والفاليديشن له علاقه برضه كذلك بالايه، زي ما قلنا بالفاليو بالاكسكيوشن. فاحنا قلنا ان احنا في عندنا 4 محاور مهمه جدا لازم ناخد بالنا منها ونتاكد ان احنا شغالين عليها كويس. اذروايز بيبتدي يحصل مشكله، وممكن السيستم بتاعي يفشل في اي وقت. وبالتالي انا محتاج لازم ان انا اكون متاكد ان احنا شغالين كويس جدا، وال4 حاجات دي عملنا عليها فاليديشن كويسه جدا. طبعا انا دلوقتي الحقيقه يعني، ودايما هسال نفسي سؤال، وات كود ميك مي فيل؟ ايه اللي ممكن يفشلني؟ لان انا الاجابه على السؤال ده هي اللي هتخليني دايما مركز وعارف ان انا محتاج اتاكد كويس من النقاط المختلفه. انا عايز اعرف الهاو شغاله كويس ولا لا، الوات شغاله كويس ولا لا، الهو والفاليو وكل الحاجات دي. اذروايز يبقى انا عندي مشكله والدنيا مش هتشتغل كويس. وزي ما احنا كده شفنا في شركات كبيره، وللاسف الشركات الكبيره دي فشلت. طيب عشان نبدا بس نبقى متاكدين ان احنا ان سينك مع بعض كلنا، انا من فضلكم عايز نجو ثرو كويكلي البول ده من فضلكم على الفاليديشن. فانا بقول لك احنا اتكلمنا يوم الخميس على الفاليديشن. يا ترى في هذه الاثناء هل انت بدات تفكر في موضوع الفاليديشن ده فعلا؟ هل هو بدا يشغل بالك؟ فانا عايزك البول، عايزك تقول لي بصراحه، تقول لي لا ممكن ما شغلش بالي، ما فكرتش فيه، نو. او ان انا الحقيقه ما اعرفش يعني ايه فاليديشن، لان ربما ما كنتش معاكم. او ان انا ساعات فكرت فيه في بعض الاوقات وبعض الاوقات لا. او انك انت تقولي لا انا بقى بدات افكر فيه فعلا وبدات اطبقه، بس بدات افكر فيه بس الحقيقه ما طبقتوش. او بدات فيه وطبقته وشفت نتائج كويسه. او اسوأ حاجه بقى تحصل، انا بدات فيه بس لقيت نتائج مش كويسه. وبرده احنا مهمنا ان احنا نكون صراحه جدا مع بعض. فمن فضلكم نلونش البول وانتظر رايكم. شباب ممكن من فضلكم نلونش البول لو سمحتوا.
It's already launched دكتور.
وانا مش شايفه على الشاشه. اوكي تمام، شكرا. طيب اوكي، فاضل شخص واحد بس من فضلك. لو ممكن نعمل في حد فاضل فوتنج، اذروايز 5 ثواني كده end الفوتنج. اوكي طيب شكرا يا جماعه. دلوقتي انا شفت دلوقتي في عدد من الناس قالوا ان هم ما يعرفوش يعني ايه فاليديشن. في ناس قالوا انها تعرف يعني ايه فاليديشن فبداوا يفكروا فيها ولكن ما بقوش طبقوا. في واحد طبق الفاليديشن وبدا يشوف الفاليديشن وطبقها وشاف جود ريزلتس، دي حاجه كويسه جدا. وفي واحد بيقول ان بدا يفكر في الفاليديشن وطبقها بس نو ريزلتس يت. فنو ريزلتس ممكن يكون لسه ما فيش وقت، ولا انت قصدك ان في باد ريزلتس؟ انا مش عارف لو تقدر تقول لنا. This could help us. Omar says please talk in English. I'll talk in English, no problem. So actually I'm asking you about the validation. So I see that some people have already started applying validation. one person has already applied it and says he sees good result. One person says he applied it but doesn't see results so far, and the others are still waiting. But there are two persons who are don't know what is validation, so that's why I need to go back for just one couple of minutes. Validation is very important. We've seen that so many projects and startups fail. Why? We discovered that many of them fail because they have a problem with one of four main axes. Either the problem is not a real problem, or it's a problem, but the problem is perceived by the startup or the project owner, but the problem is not perceived by the customer, or it is not the right problem that the customer is really suffering from. And therefore, we said in such a situation, the customer wouldn't buy this solution, wouldn't use this solution. So it is very important to understand the problem, and it is important to understand who is the customer. لأنهم حاجات related ببعض. The customer and the problem are very closely related. So our problem, and the who, which is the customer or the beneficiary who is using the customer. Sometimes you have a good problem, you have understood the customer, but the customer is not perceiving any value actually. So it's a big problem. So it is not sufficient to have a well-defined problem and a well-identified customer. It is extremely important to make sure that your project or your journey is delivering value to two parts. Delivering value definitely to the customer, to the beneficiary, and for the same time, delivering value to you yourself, to me, the owner of the project or the startup. يعني لو أنا عملت, if I run a project and the project at the end of the day is not generating revenue for me, this means that it is not generating value for me. وبالتالي احنا, and sometimes we succeed in all those three aspects, but we fail in the execution. So if you want to review that, maybe you can revisit quickly the the session in the opening ceremony about the judging, please, if you want more detail, because we'll move forward, inshallah. So now we understand there is always a question whenever we are going through our project or startup or endeavor. What could make me fail? This is a very important question. It looks negative, but it is not negative. It's a very positive question, because the outcome, if you are able to answer the question, this means that you are able to defend yourself and make yourself a success, inshallah. So we will focus on those four aspects: the what, the problem, the who, the beneficiary or the customer, the value, which is the value generated, delivered to the customer and to myself, and to make sure that I'm able to implement that in a proper way to deliver value. طيب. What is value creation? So now we will tackle the first part, which is the value, one of the components, which is the value. How we are going to generate value. And before we go to this, I just want to discuss with you a topic about how do you perceive a good surgeon from your point of view. A few years back, my mother was suffering from problems in the heart, and we were looking for a good surgeon to operate her. So we started looking around. So maybe also you may have similar needs in some cases, a surgeon or so. May Allah protect you all and your beloved ones. So if you do so, how do you perceive a good surgeon from your point of view? And that's why, please, I have a quick survey also for you. Please go for this survey, this poll. Please respond. How do you perceive a good surgeon? Do you think a good surgeon, you perceive it as a good surgeon because he has a long experience, he has a very good reputation, or maybe because he has a international education at prestigious universities or a very prestigious affiliation with one of the universities, or maybe because he's a researcher, a good researcher, he has good research and publications, or maybe because he has a high success rate. So please tell us, how do you perceive that? How do you think about that? So could you please launch the poll, please? Thank you. Okay, so 5 seconds to go. Okay, so far we see that people in the session, they believe more that this is about a high success rate. I mean, this is mainly about a high success rate. Some think long experience could be an interesting point and some research publication, but the majority is, of course, about high success rate. Okay, so actually, yani, this is your view. We would like, some say here, high success rate because it's a practical field, of course, which is really about the outcomes. You are totally right. Research is more theoretical, of course, maybe, but some of the people have already, some of the practical outcomes of the surgeons is coming from research also. Okay, so I respect all the answers. So this is, I just wanted to, this is just a teaser before we go for this discussion. This is discussion I want to discuss with you. This gentleman, a gentleman called Dr. Shetty. Dr. Shetty is a surgeon, is an American surgeon of Indian origins. And I'd like to share with you a video about Dr. Shetty and to discuss with you how do you think about this. So I'll just share with you this screen about Dr. Shetty, and there is a subtitle. So please confirm with me that you hear properly the sound of the video.
I would like to talk about the need for cardiac surgery for $800. The need and how it can be done. I'm a cardiac surgeon by profession, but I have a very interesting job. My job is putting price tag on human life. Now, you must be wondering what kind of job it is. Every day, I see about 60 to 80 patients in my clinic. Most of them are little kids sitting on the mother's lap. I examine the kid and I tell the mother that your baby has a hole in the heart. He needs an operation. She has only one question. You know what that question is? How much it is going to cost? I tell her it is going to cost 80,000 rupees, which she doesn't have. And that is a price tag on the kid's life. She comes up with 80,000 rupees, I can save the child. If she doesn't have 80,000 rupees, she's going to lose the kid. This is what we doctors do from morning till evening, putting price tag on human life. How long you will accept it to go on? Indians are genetically 3 times more vulnerable for heart attack. We develop heart attack at a younger age. The average age of my patients in England was 65. In India, it is 45. In my practice, it is not the young son bringing his old father for a heart operation. It is the old father bringing his young son for a bypass grafting. We need to do 2 million heart operations a year. Can anybody guess how many heart surgeries are done? It's only about 120,000 heart surgeries a year. What happens to the remaining 1.9 million people? They perish gradually over a period of time. In the process, we perhaps produce the largest number of young widows in the world. How long you will accept it to carry on? Why this mess? This mess is because our government spends about 1.1% of the GDP on healthcare, slightly more than sub-Saharan African countries. We thought we have to look at alternative way of funding healthcare. So around 10 years ago, we convinced our state government of Karnataka, to launch a health insurance called Yashaswini. We convinced 1.7 million farmers to contribute 5 rupees per month, 11 cents per month. And government agreed to become the reinsurer. In 10 years, over 4.5 lakh farmers had varieties of surgeries, and 60,000 farmers had a heart operation, all because of the power of 5 rupees per month. Now we are trying to convince our policymakers. We have 850 million mobile phone subscribers who are spending 150 rupees per month just to speak on the mobile phone. So if we can collect 20 rupees from each mobile phone subscriber, we can cover the healthcare of 850 million people. This is the poor people in isolation are very weak, but together they are very, very strong. When this kind of a massive transformation happens, when everyone has a healthcare, you need to change the way the hospitals are built. So 12 years ago, we started a concept of health city in Bangalore. And this is the picture of our Bangalore health city. The plan was to have 5,000 beds in one campus with the infrastructure to see about 10 to 12,000 outpatients per day. The first building is a heart hospital, which has the infrastructure to do 60 heart operations in a single day. But we have 100 towns in India with a population of 500,000 to 1 million. They can't afford to have this big health city. They need a small super specialty heart hospital. So we worked with L&T to build a 300-bed super specialty heart hospital and equip it, build and equip for $6 million. This is about 20% of what it costs otherwise. And we wanted L&T to build it in 6 months. And sure enough, they built the hospital. This hospital has come up in Mysore. In this hospital, after the heart surgery is done, when the patient is in the ward, patient is not taken care by the nurses alone. Patient is cared by the spouse. Traditionally, spouse or the family member has no role to play in the patient care. A typical heart patient on the 5th day is ready to go home. Family was not involved with the care. On the 5th day, we call the wife, give her one plastic bag filled with medicines, and tell her, ask her to take care of the husband. She is lost. She doesn't know what to do with him. Whereas if he is involved with the entire process of caring in the hospital. So we worked with the University of Stanford University and developed an audio-video based curriculum to train the spouse to be the caregiver, so that there will be continuity of the care when the patient goes home. The economy of the 21st century will be driven by health sector, because health sector is one industry which can create millions of jobs. You look at IT industry, which gets a lot of support from the government. For $250,000 turnover in IT industry, they create about 7 to 10 jobs. In healthcare industry, to get a $250,000 turnover, we need to hire 250 people. And majority of the people in health sector are unskilled people. We hire a very small number of extremely skilled, semi-skilled people. If you want a stable society, if you want a better future, we need to create jobs for rural women. As an organization, we have over 13,000 employees across the country. And at one point of time, over 90% of our employees were women. Why women? If I have the job of cleaning the floor in the hospital, I can give the job to the man and give him 6,000 rupees salary. And he will spend 3,000 rupees on himself. And 3,000 rupees goes to the family's welfare. Instead, I give the job to his wife and give her 6,000 rupees salary. She will spend the entire 6,000 rupees on the family's welfare. A woman who comes from a low socioeconomic strata, once she is employed, she becomes an empowered woman. And these empowered women will discipline the children, and when these children, they grow up, they build a great nation. This is the power of job creation for the women. The next big thing in healthcare is going to happen in India. The next big thing in healthcare is not going to be a magic pill or a faster scanner or a new operation. It is going to be utilizing IT to make the hospital safer for the patients. Believe me, hospitals are not safe for the patients. Getting admitted to an American hospital, which is some of the safest hospitals on the earth, getting admitted to American hospital today is 10 times riskier than skydiving. We need to make it safer. To make it safer, we have to use IT. So we are investing heavily on iPad-based solution, replacing the chart with the iPad, which will follow the patients. And we are investing heavily in developing simulators to train the critical care nurses to be better critical care nurses. If we can train a pilot to fly a F-16 fighter plane, with the simulator, we can easily use the simulator to train the critical care nurses. And this is what we are trying to do. For all this to happen, the cost has to come down. Cost of healthcare has to go down. If a solution is not affordable, it is not a solution. So we invested heavily on technology to get the information. We have advanced Oracle ERP solution on a cloud. We have hospitals in 22 locations. Every day, by 12 o'clock in the afternoon, all the doctors, all the senior administrators get an SMS on their mobile phone with yesterday's revenue, yesterday's expense, and the EBITDA margin. For us, looking at the profit and loss account at the end of the month of a hospital is like reading a postmortem report. Whereas having the profit and loss account on a daily basis is a diagnostic tool which will help you to reduce the cost. This is why our organization is profiled at the Harvard Business School as one of the case studies and occupied the front page of Wall Street Journal 4 years ago. We believe that India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. Why we can do it when other developed countries can't do it? It's mainly because we produce the largest number of doctors, nurses, and medical technicians in the world. Outside the US, we have one of the largest number of US FDA-approved drug manufacturing units. We have everything going for a phenomenal healthcare delivery. But never give the credit to the policymakers who you think made it happen. Everything good in this country happens by default. And if there is one country which is directly managed by God, that is my country. Thank you very much.
Okay, so you're back now. So you've seen Dr. Shetty. So Dr. Shetty is a heart surgeon. I just want to confirm that you hear me well, okay? It's okay?
Yes, we can hear you.
Thank you very much. Okay, so Dr. Shetty is a surgeon. Dr. Shetty is a heart surgeon, and he is doing, we've heard in this video how he is managing his hospital, the Narayana hospital. So please tell me, what do you think about this? Maybe can you just share a few thoughts on the chat? Do you think he's a normal heart surgeon? He's a different heart surgeon? He's doing something different? What do you think? Is he just a normal heart surgeon? Like any other you can see here and there? Abnur says he's a change maker. He's like an entrepreneur in surgery. Yes, he's doing something different. And somebody, Ramiz says he's adding value to the health industry. So he's not just a surgeon. Maybe if you're just looking as a surgeon, you are going to look how he is doing, if he's just a very efficient expert in surgery, but here he's doing something else. And Abnur says he's taking it to the next level. But Muhammad, he has a question, Muhammad, and says, what is his business model? Very nice. We need to think about this. And Abnur says also, maybe it seems like a crowdfunding thing. It's a good idea. I don't know if this is crowdfunding. I'm not quite sure about that, but this is a very good idea, actually. So now people start thinking. So if this person is behaving like an entrepreneur, how is he running his business, this hospital? So actually, before going to this, I'd like to know, I'm sorry, this is I'm curious to know, after you heard Dr. Shetty talking about his experience, do you still have the same perception about a good surgeon, yes or no? So could you please just launch this poll also for us, Shabab? Do you still have the same perception, or maybe it has changed a little bit? So some people say, guys, I want you all to respond to that because we have only 50% of response so far. I wish really to hear from all of you. But so far, it makes sense for me. I see that some people have changed their mind to some extent. Some 60% have definitely changed their mind about their perception about a good surgeon. They perceive it differently now. So maybe we should end that and move forward to the presentation directly. But so this is it. Some people think the majority have changed their mind. So they think differently about a heart surgeon. Okay, so do you think, what is the problem Dr. Shetty is handling from your point of view? What is he trying to solve? I wish if we can communicate, this would be great. Maybe, I don't know if this is possible to give hand to people to talk. In this session?
Yes, it's possible if one.
Okay, so maybe if people need to intervene and they just raise hand, maybe the admins will allow them. I like Muhammad is saying something. He says he wants a solution. He wants to make it affordable. And Omar is saying he's trying to solve what the world cannot afford, actually. and provide, Ahmed also says, provide good quality healthcare. So we say good quality. So now, this is the first thing, guys. When we talk about problem and solution, this is the first issue, the first trap I don't want you to fall in. The first trap is to start delivering solutions. The main problem of entrepreneurs is the understanding of the problem. Delivering solution is probably very easy. It's not very complicated. But if you don't deliver the right, if you don't understand the problem, if you don't define the problem correctly, you may come up with inappropriate solutions. So I wish that at this stage, when we talk about the problem, that we concentrate on the problem. What is the problem that Dr. Shetty is trying to solve? So it's not about a good healthcare. Good healthcare, maybe this is an outcome, this is a solution. So please forget about this now and try to come up with some problems. What is the main problem Dr. Shetty is trying to solve? So, because this is really, this is the essence of entrepreneurship, is about understanding the problem. So, can you just tell me what is the main problem he's trying to resolve? What is the main problem he talked about? He didn't talk about somebody tells me about quality. I don't think that this was his main problem. There was a more major problem than that. Ramiz, again, Ramiz, I really appreciate what you're talking, but Ramiz, you're telling me about the solution. I want you to tell me the problem. You see, this is always for everybody, all the innovators, all the people that want really to ideate, and creative people, they are really tempted by going to the solutions. It is very important at the first stage to be able to characterize and describe properly the problem. What is the problem Dr. Shetty is trying to solve? Yani Abdul Noor, Muhammad, Ramiz, you came up with excellent outcomes in terms of solutions. I want the problem, a very well-defined problem. So Abdul Noor says he created jobs, empowered women. Yeah, very nice. Okay. Abdul Noor says, I want a minute. You have your minute. Omar is raising hand. Please tell us. A recap on the case. Okay. No, so actually, and it's difficult to have a recap on the case, but actually, Dr. Shetty is doing a lot to help people. But again, doing a lot, this is an outcome. The main problem, of course, we have a problem that was already defined in the title of the video. And some of you providing affordable, good quality healthcare is not a problem. This is a solution. I want you to make an effort to identify and describe the problem he's trying to handle. Maybe we start now having some good ideas. Abdul Noor, Sami is trying to come up with something. It says now that this is the heart surgery is an expensive thing. So heart surgery. So we say now we have expensive heart surgery. So this is becoming a problem. If you recall, so now he has a problem that many people are many people are dying every year because of the heart issues, heart diseases, and they are not getting the service. So there is a problem that there is a high demand on heart surgery, and there is low supply on the heart surgery, so they cannot. And even if they want to supply the heart surgery, this is a very expensive. So now heart surgery is not affordable. Heart surgery is not affordable anymore, not affordable for people. So it is not only scarce, but at the same time, it's not affordable. Okay, so, and Muhammad says, people losing trust in surgery due to poor quality. This is another aspect, actually. I don't think that Dr. Shetty tackled the problem of poor quality in this video, but he talked about the problem of unavailability, unaffordability of the service. So this was one of the main problems. And the customer, he's talking about who is the customer mainly? Who is the customer? So we see who is the main beneficiary from that. So actually, because heart disease people, yes, this is Abdul Noor is very important now. So because we are now starting to tackle the problem to core. Abdul Noor says heart disease people. Heart disease people, it looks like it is maybe correct, but correct to some extent. Why? Because he was talking specially about kids. So it's not so he wants to يعمم العلاج لكل الأسر, ولكن he was starting by talking about kids. So it is very important, and we'll see this again, inshallah, tomorrow. It is very important to do a proper, to identify properly your customer, not to have a large population of customers, but to be very focused. Who is really your customer? If you want to serve your customer properly, you need to focus. Muhammad says again, maybe this is more about villagers. You are right. Definitely this is about poor people, because people who cannot afford, you are right. So, but I want to be more precise. So this is about Abdul Noor, start to be more precise. Thank you very much, Abdul Noor. I really appreciate. So Abdul Noor is trying to combine. So it's about being poor, yes, heart disease, of course, and mostly about kids. And maybe we can add to them villagers, maybe more, because in the villages, they don't have access to those resources. So it will be important to focus on the customers, to be more precise. And we'll see that again and again, inshallah, tomorrow. But so what is the value now that is this guy delivering to those? Please tell me. Yes, so what is the value? Abdul Noor says the value is, this is an emotional value. Very good question, by the way. Somebody, Muhammad Rihan, is asking, do you mean by value the solution? Very good question. When I say value is completely different from solution. Value is completely different from solution. Yani, I'll tell you, yani, if you think about these families, the parents who have their kids who are suffering from these heart diseases, and they want, do they care about a solution, or do they care more about what is the value I'm receiving? Do I care if the solution is provided by Dr. Shetty, Dr. X, Dr. Y, or Dr. Z? Does this make any difference for me as a parent? Does this make a difference? No. Do they care about the price? Somebody says about the price. Maybe they care about the price, but what they care more about is that they get the service. العلاج. Fatima, shukran Fatima. Thank you very much. I really appreciate your participation. So it is not about the price. Of course they care about the price, but they care about getting the the العلاج نفسه, getting the care service, and getting the treatment. So they want their kids to be properly treated. So you are right. I get it. Get treated, and right now. So now you become much more. So you see, we become more specific about what we're talking about. So the guys, the parents, take care. What they want their kids to be treated. They don't care about maybe the price at the beginning. They don't care about who is doing this, if this is the best doctor in the world, if this is not a famous one, not a famous one. They want their kids to be properly treated, because otherwise they will lose their lives. So it is very important to understand what is the value. So now, do you think, we are just thinking about the large value that they are treated. But do you think that Dr. Shetty is offering other values also? I will discuss it, but now I want you, because we will discuss these several the axes, the problem, the beneficiary or the customer, the value, and the how more in detail. But now you become more sensitive. We have a specific problem. We have a specific customer. We want to deliver a specific value to the customer, and don't confuse the value with the solution, because maybe you will find many solutions, but what is important is that this solution is delivering a true value. Abdul Noor says he's delivering good price, he's humanitarian, and that's why this will make parents trust him. Thank you very much, Abdul Noor. So maybe now, this guy, Dr. Shetty, is not providing only a value in the price. He's providing a good value in terms of price. He's providing a value in terms of treatment. He's providing a value in terms of trust that Abdul Noor is really talking about. And Muhammad Ilyas is saying he's providing comfort. So now parents feel comfortable with this guy. So they feel trust, there is confidence, all this is delivered on top. Do you think this is a valuable thing, the trust, especially for parents who are panicked about their kids that may lose their lives, la samahallah. So that they cannot afford the treatment. This is a big value, although this is not materialistic, but this is a big value. So it is very important to think, when you talk about your customers, about the value perceived by the customer. And you see, when you say trust, comfort, not all those are converted directly to materialistic things. So not to the solution, but they can be implemented in the solution. Right. Next, the execution. The execution is a big thing. How did this guy execute his idea in order to deliver the value? And this is the main question about this session, actually. How is he creating value? He's doing something strange, actually. Why? This is a heart surgeon. I just want to share with you here the results of this guy. By the way, Dr. Shetty is an Indian guy. Believe it or not, Dr. Shetty, he has one of the highest success rates in heart surgery worldwide. And just to let you know, the mortality rate at Narayana, at his hospital, is 1.4%. Sorry, is 1.4%, while in the best US, the top US hospitals, this is 1.9%. This means that his mortality rate is better than the best US hospitals. In his hospital, the average price for a heart surgery is about $2,000, while in other Indian hospitals, this is about $5,000. In the US, this is $20,000 to $42,000. So while he's providing the highest standard here, the highest quality of healthcare services, he is doing it at a very small price compared to the other hospitals. What he's trying to do more, you know, I told you about the case of my mother. When I was looking for a surgeon for my mother a few years back, I visited so many surgeons, and actually I went to several hospitals in Egypt to see which doctor, which hospital could really do this surgery for my mother. And there were cheap hospitals at the universities, and there were very expensive private hospitals that has very good reputation also. And when I tried I started my investigation, one of the professors at the university told me, Yani, when you go, he told me, I'm doing the surgery both at the government hospitals, the university hospitals, and at these very expensive hospitals. And he told me, I will be very frank with you. The issue, when you go for the very expensive hospital in Egypt, you are paying for the price of the gardens around the hospital. In the government hospital, which is the university hospital, you are just paying the price of the treatment. So now you are paying for the luxury around the private hospital. And he told me, I'll just give you an example. I said, you know how many operations we are undergoing every week here, and how many operations are executed in the private hospital? He told me the private hospital is running 5 operations, 5 open heart surgery per week, while in the university hospital we are performing 5 operations, 5 surgeries per day. And he told me, what do you think about that? This means that we have 5 more times experience than the guys in the private sector. And this is what is happening with Dr. Shetty. Dr. Shetty, he says that surgeons working with Dr. Shetty who are maybe 35 years old, they have the experience of surgeons in the US who are 50 years old. Why? Because they are working 18 hours per day. They are performing many more surgeries per year than the US hospitals. And that's why we see here the numbers. In the numbers here, they execute about 3,000 surgeries per year, while in the one of the top US, this is the US leader, the Cleveland, this is just performing 1,400. So you see, this is a big difference. And for pediatric patients, they have 2,700, while the Children's Hospital in Boston is just executing 1,000 surgeries. So we see the experience. So this guy is so successful. And actually, what is more striking than that is the outcome in revenue, because somebody was talking about the business model. Actually, we haven't tackled here the details of the business model, but what we can see here, that this gentleman hospital, the hospital of Narayana Hospital, is achieving a profit of 7.7% profit, while the US hospitals are achieving a 6.9 average percent in profit. So they are exceeding all the numbers, the profit, the number of surgeries, the mortality rate is lower, everything is better, and it is much cheaper. How could this guy do this? This is just a surgeon. So what is very special about this guy? The very special about this guy, this is what I want to discuss with you. How he did this is how he did this through his ecosystem. His ecosystem is just about the components around him, the environment around him. So you see now, it is very important, if you recall what we talked about this morning, how to become, you don't need only to have a maker profile in your team, you need to have also a mobilizer profile, a mobilizer profile that is able to use the ecosystem. So please tell me, I want now your participation in the chat. Please tell me, how did Dr. Shetty participate? If we agree that this is the hospital, this block is the hospital, Dr. Shetty, what other things has Dr. Shetty used from his environment to deliver the value? Please help me about that. What extras? While actually he's just a surgeon. Somebody says he's also a magician. Can you tell me, from the video we've watched together, do you think, for example, when he was talking about, do you recall when he was talking about the insurance? Do you recall that? What is this type of insurance he's been working on? Is this important, what is done? Some says this is about something equivalent to a crowdfunding. This is not really crowdfunding, but this is some sort of funding. Yes, you're right. So Dr. Shetty, he is a surgeon, isn't he? Who is responsible to provide solutions or insurance, health insurance for the villagers? Is this a surgeon who is, do you think it's the role of the surgeon? I just want to tell you, yes or no, is this a role of generally the role of the surgeon? No, it is not the role of the surgeon. This is most probably the role of the government. This is the role of the Ministry of Health in India. But Dr. Shetty, as we said this morning, is taking the extra mile. Why? Because by taking the extra mile, he as a surgeon will be allowed to deliver value to many more surgeons, to many more villagers. So he is improving his own value by doing this. So he went to the he went to the government, he went to the insurance companies, and they created a solution that would help them deliver the value to the villagers. Somebody would say, this is not his job. He is a surgeon. He should take care about doing surgery. Yes, but this guy thought, if I don't do this job, I still cannot afford the surgeries for people. Very few people will be able to get the service of the heart surgery. So he did this effort. What else? What else did you think about it? Just tell me, do you think about other things he has been through? Provided women jobs. Yes, is this his role? He is a surgeon. Why should he care about women jobs? Why? Did you think Omar, he provided, he empowered women. Why did he do so? He explained that explicitly. He said that women are taking more care about the welfare of their families than men. And so he thought that if he needed some jobs to fulfill some jobs in his hospital, he would pay the same amount of job, the same amount of salary to a lady or to a gentleman. But he thinks the extra mile always. He thinks that if he gives the job to a gentleman, to a man, he will spend a big part on his own, but for himself. But if he delivers the 6,000 rupees to a woman, she will spend the whole amount on the welfare of the children. So this guy thinks that If I empower women, then I will be able to save the society. I will be able to save the kids. So that's why he thought about empowering women. So this is very important. One somebody else would think, again, he is a surgeon. Just take care about your surgery, do it well, and you'll get the highest salary because you are a very good surgeon. Still, but he is taking care about women. Have you thought about when he was taking care about caregiving in the hospitals? Have you seen that? What is this caregiving? What is this topic he's talked about? Take caregiving. فاطمة شكرا. تمكين المرأة، مساعدة الأطفال، الانتماء، تعزيز الانتماء. Fatima is saying something interesting. تعزيز الانتماء إلى الهند. I really appreciate that. And Alia wants to share with us. Please, Alia, share with us your thoughts. Alia, you can share with us, please. And Omar. Ramiz is saying about education. What did they do about caregiving? Raising doctors and medicals in India. Abdul Noor. Yes. So now he's raising his staff. So this is the staff, maybe the medical staff. And he's not talking only about the medical staff. But what do you think the added value he made when he mentioned the caregiving? He said that the caregiving, when a patient is leaving the hospital after he is operated, after he had undergone the surgery, he needs to go back home. And when he goes back home, this is a sort of rehabilitation phase. And when he goes back home, he needs still some care. So nobody will take care of him. So if there is nobody to take care with him, he would need to stay at the hospital for somebody to take care of him. If he stays longer at the hospital, what will happen? This means that he is occupying a bed in the hospital, and he is banning, or he is restricting others from getting the service at the hospital. So we want to get the patient out of the hospital as soon as possible. But if we get the patient out of the hospital, he needs treatment, and people are not able to treat him. So how to do that? So he started thinking about the solution, how to give a training to his family, so that they can offer him, they become caregivers, so they can offer to him the care needed when they return back home. So one of the advantages, first, he can return back home sooner. This means that he will leave the hospital and leave his place at the hospital for other patients to get the service. This is one. Second thing, maybe, I don't know, one of the biggest problems of all hospitals is the disease transmission. So all the hospitals care a lot that the patients leave the hospital as soon as possible. They don't spend they don't want the patient to spend one more minute in the hospital, because this is very risky. They want them to leave the hospital as soon as possible. And so what this guy is doing is he is trying to protect the patients by allowing them to leave earlier. He is freeing the space in the hospital to offer service to others. At the same time, think about it. His family, now they are trained to be caregivers. What is this? What has he done more with that, about the family? Customer service, yes, customer service, but at the same time, now the family, for example, the wife of the patient or the husband of the patient or their kids or so are trained as for basic care service at home. What can they do with that? Do you think this? What can they do with that? They have knowledge. This is good. What else? So knowledge, this means that they have added value to the society. So now we become more knowledgeable. Now we become more knowledgeable as a society about taking care about our families. This is one thing. What can they do more about that? Do you think next morning, if there is another person who is sick and he's returning home and he has no family, who can help him by that time? Now we start having a database of caregivers that can help others. This is one thing. What else? He was talking about something else. He was talking about empowering. When he was talking about empowering women, he wanted really to empower and to raise the standard in the community. So now the woman who was trained as a caregiver, maybe she can also she can offer caregiving services for others against a certain fee. So he is creating jobs. So he's creating jobs for people. So he's creating jobs. He's creating more comfort. So people will take care about their families more than others. So he's doing all this. So you can imagine. I just want to say. So when, sorry, I want to see the screen here. So you see, for example, he was about the carers, the caregiving. So he has done the caregiving. But in order to train the caregivers, how did he do that? He did that alone? Or how he do that? Do you recall this name, Stanford University, in the video? Actually, he didn't do that just in an amateur fashion. He tried to do it in a very professional way. So in order to train the caregivers, he went and developed some training material, and he didn't develop it just on his own. He developed it with one of the most prestigious entities, Stanford University, one of the most prestigious universities worldwide. So he didn't do that just in a simple way, but he is really caring about quality. He's caring about having good caregivers, and he partnered with Stanford University. So you need to think now. Previously, he partnered with the insurance companies, with the government, in order to create an insurance for the villagers. Now he's partnering with Stanford University in order to provide training for the families, and he's using the families. Maybe you can think about the families as some partners with him also, in order to provide caregiving. Excellent. What do you think? What you've seen, what you've heard about this tablet, IT, Oracle, what did he do about that? What should a surgeon do with the tablet, care about the tablet or about Oracle? Why he's caring about that? Can anybody help us about that? Yes, Abdul Noor says he found the hospital with SMS messages. Why do this guy take care about the SMS and tablet and IT systems? He's a doctor. He's a surgeon. This is the job of the IT guys to think about it. No, this is not. Yes, this is the job of the IT, but this is the job of the guy who has the leadership and the ownership and wants really to make his project a success. He discovered that I have a very important tool called SMS, very simple tool. Everybody knows how to treat SMS. Everybody has SMS on his phone. This is not a very special technology. What can I do with this? He decided to take ownership, to share the ownership, this leadership role with all the staff in the hospital, and share with them, to tell them, what are our expenses? Are we achieving our revenues as we should? Or maybe we are overspending. And in order to do so, he is delivering to them account numbers every day, so that these guys are aware, so that these guys become very sensitive, very conscious. We are all conscious, we are all aligned, we are all have the same vision. This is about communication with those guys. So, okay, so we have seen that, so this guy has made use of all those elements, the carers, the IT, the tablet, and he has been doing IT simulation for training his caregivers also at the hospital. So he's making use of every capacity and every asset around him. So he has now an impact on the society, on the families, on the patients, on the overall society. Of course, we have seen also what he did with the real estate agent to help him in building the new hospitals. And we've seen now he thinks more to extend more his services by tapping on the mobile subscribers. He discovered that mobile subscribers are paying a lot on mobile technology, on mobile communication. He thought, can we tap on that in order to get a very free percentage? And again, this is a revenue model. This is a business model. Maybe we can get a free percentage of the subscription and inducted in the system to improve the system. When this guy at the end of this video mentioned that his video was his case, the Narayana case, was mentioned in Wall Street Journal. What is this? What is the value of that? What is the value here? Can you help us? Anybody can tell us what is this? So actually, do you think this guy, what is he doing in this video? He's making use of everything in his video. Please tell me, have you seen on which channel is this video published? Have you seen which channel is publishing this video? TED. Thank you, Abdul Noor. So what do you think? He's making use of every possible asset, every possible element in his entity to make use of it. He is making use of the TED. TED now is one of the guys helping this, because now when we see this video, we are fascinated about Dr. Shetty. This is done through TED, and this many thousands of people or many millions of people will see it. Maybe somebody will say, this is a very nice experience. I would like to crowdfund that you had discussed, you had talked about at the beginning. Some of the people have talked about crowdfunding. Maybe I'll think, why not crowdfund? Why not fund Dr. Shetty? Because this is for a very good purpose. This is saving lives of people. This is really delivering value. Why? I can do it. So he is making use of TED as one of the platforms to help deliver his value. This is not just a thing. He has there is a very well-known case study published at Harvard Business School, one of the most prestigious business schools in the world. The case of Narayana and Dr. Shetty is one of the major cases in Harvard Business Schools. So why he's doing so? He's making use. Why he is telling us about how? Because he wants to promote, he wants to make his solution and his value the highest possible. He's trying with every element, he's increasing the perceived value by the customer. Wall Street Journal is the same thing. So making use of Wall Street Journal, of Harvard, of TED, whatever. So he's trying to make use of every as possible aspect in order to deliver value. I think we can see Dr. Shetty is not just a surgeon. Definitely is not just a normal surgeon. Now, if you have the top surgeons worldwide, by the way, Dr. Shetty is one of the top open heart surgeon worldwide. But if you put him and try to benchmark him against very other good open heart surgeons, do you think they will be on the same, they can stand at the same level? Do you think that the perception of you, of the society, of the patients, of the doctors in the hospital, of the community, can they be perceived at the same level? I think this is not possible. Why? Because he's created value for himself. He's created value by understanding properly the problem, by understanding the value that his customer are expecting, and he tried to add as much as possible, make the maximum he could, the utmost with the ecosystem around him, the environment around him. All other doctors, all other surgeons have all these elements sitting around them, but they are not making use of those. But Dr. Shetty was able to make use of those and to turn them into value for himself and for his main customer. So this is it. And again, I just want to remind you, Wall Street Journal called him the Henry Ford of heart surgery. I remind you about his figures, his achievements. But what I want to share with you as a last thing, please, I want you to share with you this very short video, just less than a minute. Please watch it with me. Do you know who is this guy? You know, this is Charlie Chaplin. And this is a very well-known movie. It's called The Modern Times, actually. And Charlie Chaplin in his Modern Times, we can see here that this is just an analogy. I want to make an analogy with what is happening. Because if you can see, I've described the ecosystem as cogs. And we see here Charlie Chaplin is really between the cogs. And we see that if Charlie Chaplin is not there, the cogs will not be able to interconnect, and the engine will not turn. So it is very important that to play the role of the Charlie Chaplin. So when you have an ecosystem, if you don't play the role of the Charlie Chaplin, you are not able to interconnect this ecosystem properly. You are not able to deliver the value. So always recall that you, in order to deliver value, you would need to do the effort of the Charlie Chaplin. Although the effort of the Charlie Chaplin looks like a very tedious effort. But unfortunately, if you don't do the effort of the Charlie Chaplin, probably you will have to work as a Charlie Chaplin for somebody else. This is a problem. So better work as a Charlie Chaplin in your organization, for your value to deliver value for your customers. Recall always that you have so many opportunities around you. The idea, the essence is making use of those. So we didn't discuss maybe the drug industry and all those aspects. So please recall that this is very important. About delivering value, you need to understand properly the problem, you understand properly the customer, his demands, his requirements, you understand your capacities. What do you have under your hand? And under your hand doesn't mean that you possess them. Maybe they are around you. You just need to think and look around you in order to detect all that. And if you detect all that, you are able to really make a big difference. So I wish This is all for today. I really wish that this was helpful for you. Please, I want you to start focusing on the problems you want to resolve, to understand properly, to try to understand very well the customers or the beneficiaries. What do they expect from you? What value they expect from you? And start working on this. Start building your ecosystem. Your ecosystem is not only you. You have many resources that you can make use around you. So please make use of them, because inshallah, you will do an outstanding job. So I wish this was helpful for you. Inshallah, thank you for your attendance. Thank you for your participation, for all those who participated. This was really great. And see you tomorrow, inshallah. Shukran jazilan. Assalamu alaikum.